A lot of patients ask me, should I keep my scar dry or should I keep it moist or wet? And I say wet. Why should you keep it wet? Think of a Grand Canyon. And if you want to cross the Grand Canyon, you would have to climb down one wall, walk down through the canyon, and then climb the other wall. Or you fill the canyon up with water and then you just take a little boat and you can cross it so much easier. So what you do with a scar that is moist or wet with ointments or scar gels, this reduces the overall surface tension. So the cell migration is getting much faster and the cells quickly blend in. There was a paper in Nature maybe 60, 70 years ago. Nature is the most respected scientific journal on this planet. And already then did they suggest, okay, keep the scar moist because it heals in half the time and it blends in better, so it looks better. So first and foremost, keep it moist. Then keep it clean. There are many different ways to keep it clean. You can use water, you can use peroxide, anything that your surgeon suggests. Another thing is, as long as the scar is red, protect it from sunlight. So the redness is because there are a lot of repair cells going into the area of wound healing, producing the tissue that needs to be produced, scar tissue, to connect the wound edges and stabilize the wound edges. As the process subsides, the redness goes down. As long as it's red, it's very sensitive to UV light exposure, and what could happen is if there's too much UV light exposure, you can create a chronic inflammation that would stimulate pigment cells, so the cells that are working for us when we want to get a tan, and they get stimulated by the chronic inflammation, creating a fake tan into the scar, which is a scar darkening, and it's a proper headache to get out of it, pun intended. Another little trick is zinc, either tablets or you can have SPF with zinc. Then you're killing two birds with one stone. Zinc is a micronutrient, so it's something that feeds the healing scar. It accelerates cell proliferation, cell maturation, scar maturation, collagen production. It's really, really good and effective in healing. So these are three little tricks for your scar healing, but nevertheless, please discuss everything with your surgeon, because just because I said so doesn't mean it has to be done, and maybe your surgeon has a good reason not to do one of these particular things in your particular journey, and if so, they will be able to explain it to you.